Well, hi there. I'm Brandon Awan, and I will be your host today for this edition of DJO's Vascular Division. How do you make that thing work? As you guys have already decided, you guys have already chosen DJO's Venaflow Elite system for your vascular, or for your DVT prophylaxis pump for your sequential compression device. Now, so you guys are already very familiar with the clinical differences between your slow inflation and your rapid inflation device. So today we're going to get into the basics of how to use this pump. Okay. Here is the DJO Elite pump. You're going to notice a few different things different from our old ones and from your pump you may be using already. The pump is nice and lightweight, weighs a little over 4 pounds, so it's great weight, not too heavy, not burdensome for your clinical staff, which is great. You're going to notice that we have a bed hanger on the back here. This bed hanger is very nice and easy to use. The nice thing about it is it fits on almost every bed that I've seen in a hospital. It telescopes out, so we've got this button here on the top. You just push that down, and it telescopes out. Allows us to hang it on a big surface area, or we can ratchet it in, and it's going to fit nice and snug. Okay. The other pieces you're going to see is your tube connection right here. The tube connection is nice and easy. It's a Kohler connector. You just push in right here, snaps in place. Okay. Now, tubing, this is our standard tubing I have on today's pump. This fits great at the end of the bed. It's a little over 5 feet, about 5.5 foot long tube. This tubing is clear, which is nice because it's easy to clean. You can see if there's any kind of debris on it. As well as the other pieces you're going to see is our buttons that are on here. Now these 3 buttons, what do? We've got the middle button, which is our green power button. We have a timer on here that's for monitoring compliance. And we also have the 1 leg over the 2 leg button. Okay? Now, the first thing you're going to want to do is you're going to want to hang the pump on the bed rail. So we would typically hang this on a bed rail somewhere and get it where it's in place. The second thing that you're going to do is you're going to want to apply the cuffs. Let's talk about the cuffs. So, secondly, we're going to apply the cuffs. Today we're using our calf cuff, which comes in 3 different sizes: universal, extra large, and bariatric, respectively going up to about a 300-pound patient, 600-pound patient, and up to a 1,000-pound patient for your bariatric cuff. Okay. With regard to the cuffs, if we had a leg, we would apply the cuff snugly onto the patient's leg. You don't want it too tight, but you also don't want it moving around. The air cell bladder is on the back right here of the cuff, but it does not matter where on the patient's leg that goes. Okay. So step 2, we're going to apply that cuff. You're going to put it on the patient's leg, and the tubing is going to go down. Okay. So you're going to have that towards down to the bottom of the foot, towards the heel, or towards the top of the foot. It doesn't matter. Like I said, this can go anywhere on the surface of the calf. Okay. After you have applied the cuffs to the patient's leg, you're going to connect those tubing assembly. This tubing connects very nice and easily. Again, Kohler connector goes like this. You push in, it snaps in place. Okay, nice and snug. To release it, you don't want to yank it out, but you want to push down and pull. That allows it to release. Okay, so we'll leave those connected. So, first step, bed hanger, hang the pump on the bed. Second step, you're going to apply the cuffs. Third step, you're going to connect those tubing. Okay. Now, after we've done that, we are going to press the power button. This is the green button right here. We're going to power that on. You're going to notice that it says it is detecting the cuffs. Now, what does that mean? It means that each patient is individually different size calves, different foot cuff, maybe a foot cuff versus a calf cuff versus a thigh cuff. So for the first minute, it's going to be detecting the patient's leg to make sure to figure out what kind of cuff is on the patient's leg. Also, it's going to be detecting how much pressure to apply to get that increase to what we talked about when we were describing the clinical outcomes of Venaflow, is an increase of up to 65 millimeters of mercury, settling around 45 millimeters of mercury. So that's what it's doing. So it's detecting those cuffs. It's also going to go through that detection process to help detect 1 or 2 cuffs that are on there. Now, after it's done that, again, you're going to see the regular screen. You're going to see a 1 leg over 2 leg button, the power button, and your compliance monitor. The 1 leg over 2 leg button. Now that at this point in time, anytime in the first 3 minutes of powering on the pump, you can decide if there's 1 leg or 2 leg. If a patient maybe is a surgical case wouldn't allow it for one of the cuffs to be on. If they're a burn victim, an amputee, maybe you're only using 1 cuff, whatever that instance might be. You can tap that 1 leg over 2 leg button anytime in the first 3 minutes, and it takes it down to a single leg modality. With that said, it's going to figure out if it's the right leg or the left leg. Don't worry about trying to figure out right or left. It'll figure out which leg does not have a tube attached to it. So you want to make sure whichever one's not being used doesn't have that cuff attached to the tube. Okay. After that, it will determine. It'll go ahead and continue detecting if it's a foot cuff, calf cuff, or thigh cuff. It'll shade this cuff in. If you can see, that'll shade that leg in, either the foot, the calf, or the top portion for the whole leg for the thigh cuff. Okay. For this demonstration, we're going to assume we have both cuffs attached, and we're moving on. Now, the other things that you might see is the compliance monitor. Now, we have a compliance monitor on there, and that is going to be for monitoring compliance. We know that DVT is the #1 litigated complication nationwide. They're also the #1 preventable complication for a hospital. So, monitoring compliance and enforcing and getting compliance from those patients is really key to reducing those DVT rates. So, just another added tool to be able to help you guys monitor that and again, reduce your DVT rates. Now, you'll notice on the top that we're going to have our different signals on there. Now, what that's going to do is it's going to show you what each one of the buttons means, as well as what maybe the alarms might mean. So we're going to have different alarms possibly that can go off. Nice thing about Venaflow is we don't get very many erroneous alarms, false alarms. But one thing we do notice is we will get is if we get a tube alarm, if you have a kink in your tube, then we want that alarm to go off because we know that that cuff is not being inflated properly. The other one would be leg alarm. If you have a patient who has taken off the cuff and they're not wearing it, or they got to go to the bathroom and came back and the cuff wasn't applied again, that leg alarm is going to be able to help us determine that. And then the third one, which we don't see very often, is going to be a call for service alarm. That call for service alarm allows us to know if something is internally wrong with it malfunctioning on the pump, and you can just send that back down to your biomed department, and we'll send them a new pump or repair the one you guys had sent to us, and make sure you have enough pumps for your patients. Now, if an alarm does go off, what are you going to see? You're going to see first these green lights go to red, blinking. You're going to get a quiet chirp, and it's going to tell you what's wrong on that screen. Like I said, tube alarm or leg alarm is going to be most commonly seen. Let's say it's a tube alarm goes off. You want to do is check the tubing. You're going to want to check that tubing, make sure there's not a kink in it. When you're done with that, you're going to tap the green button, and that'll reset the alarm, and the pump will automatically turn on. So, to reset any alarm, first, fix the problem, then tap the green button, pump powers down, power back on its own. If it was a leg alarm, you would simply either reapply the cuffs to the patient's leg, tap that button and it resets, or if the patient's not there, just turn it off. Next time you turn on the pump, it'll start over through that detection process. Okay. For now, that's the ins and outs of the pump. That's how it works. Like I said, if you have any questions, please reach out to your vascular specialist or to your local territory manager. Thank you for attending this edition of DJO's Vascular Division. How does it work? Till next time.